Typical symptoms associated with heel pain are first step in the morning, getting out of bed and having significant amount of pain. And then during the day that pain may resolve. You may actually begin to walk around and within just a couple of minutes feel fairly normal. As you sit back down or as you're at work and you're at your desk and you go to get a drink, that pain returns and you walk around with a limp until it resolves again. 80 to 90% of those cases are treated very conservatively in my practice. We typically like to evaluate mechanics. We like to see if there's anything that we can do conservatively to modify mechanics, to make some changes, maybe put an insert into the shoe. We have people begin a very simple stretching regimen. We have them ice, maybe take some anti-inflammatory medications. If things like that don't produce some relief, then we at times will become a little bit more aggressive. You often hear about the infamous shot in the foot. It can be uncomfortable. We've got some techniques that really make it so that the symptoms are, it's fairly easy to get that injection. And one of the most satisfying things that I'll see in my practice is when a patient comes in with a couple of simple interventions, have them walk out of the office literally pain-free after being in pain for weeks and months and years at times. I pride myself on conservative care with a tailored treatment plan based on the patient's needs or their work or whatever it is that their specific needs may be. But certainly I think there's a lot of value in conservative care. In almost all instances, whether it's with an injection or with an orthotic in your shoe, with stretching or strapping or taping or anything like that, nearly all of these cases are resolved without anything surgical. There are a few surgical options that are available. Recently there's really been some advancements in some very straightforward in-office procedures that will allow you after, again, many months or years of discomfort to come to the office with a little bit of a numbing injection. We can do a procedure. You walk out with a Band-Aid on your foot and, again, a very high success rate at alleviating those symptoms. There are very few situations where surgery is indicated. But thankfully, there's some good options. We've got a system where we can do endoscopic, where we use a camera system, where we go in with two very small incisions and release that ligament and provide relief of symptoms. It's fairly uncommon to actually have to get to that point, and I usually like to wait a minimum of 6 months before we incorporate surgery into this syndrome.